and it's been like that since what, 5 o'clock? Anyway, you know, I remember it from last year. I don't know if you remember. I remember it getting dark early last year, and now it's happening again. You take it for granted a bit in the summer, don't you? But anyway, winter's here. Let's embrace it. It's Christmas soon. So we've got some questions here. If you've got a question yourself, then please do not hesitate to post it, and I'll do my level best to answer it. I have some questions which have already been sent in by our listeners. And Jackie's here. Good to see you, Jackie. Now I've got a rather precarious setup with the phone because my tripod is broken, and so I'm balancing it on the computer. So I hope it doesn't fall off like it did the other day. How long prior to surgery do I need to stop smoking? I should say, I was thinking about this question. I thought, I must say it's my view, this, because everyone's got different views on it. But to be honest with you, most of the stuff I talk about is my view, and probably someone's got a different view on pretty much everything I would imagine that I'm going to be talking about. So that's a disclaimer that covers the whole shebang, really. It's a lot of this stuff is not written in stone. I guess that's why you're asking, because I guess if you Google it, I wonder what comes up if you Google it. Maybe that's why. Maybe that's why this is so popular. Yeah. All right. No need for that. Right. So I mean, ideally, well, first of all, it depends on the surgery. So if it's having a mole removed, or some kind of minor surgery with just a little incision, and the wound's not closed under too much tension, then I wouldn't say you had to stop smoking. So if it's a minor procedure, I'm assuming this person's asking for a major procedure, for like a tummy tuck or a breast augmentation. Lorena is in the house. Nice to see you, Lorena. God knows where she is. She's probably in the supermarket or something watching this. So I'm assuming it's a bigger operation, like a tummy tuck or something like that, or a breast lift or augmentation or something like that. So ideally 6 weeks before would be the ideal. Now, a lot of people would say if it's 6 weeks before, then that's going to mean stopping forever, sort of thing, which is not necessarily a bad thing. And I'm not saying this to get people to stop smoking, although stopping smoking is obviously a good thing, so that would help your health. But the reason that we ask people to stop smoking is because the surgery that we do is always closed under tension, and if the wounds don't heal up, it can be very, very bad. And if you smoke, you're increasing the risk of the wounds not healing up properly, because every time you have a cigarette, the blood supply to the skin is reduced, and you're increasing your risk of the wounds not healing up properly. So it can be disastrous, particularly in body contouring surgery, which is what most of the surgery I do. GA procedure, says Lorena. Okay, so it's so it's a big procedure. So ideally 6 weeks before, but the really crucial time I always tell people is from the day of the surgery to 2 weeks afterwards. If you stop less than 6 weeks before, you can get a cough, and that can cause a problem during the surgery. So really from the day of the surgery to 2 weeks afterwards, that's the critical healing time. So you really must not smoke, zero smoking during that time. Now, sometimes people will have, will say they've stopped smoking, but continue smoking. And there are surgeons who will do tests. We talk about this at our meetings, and some surgeons will test patients prior to surgery to see if they've been smoking, and cancel the surgery if they is signs that they have been smoking. We don't do that, and I try and get it on the patient's side type thing and say, look, you want it to heal up as well as I do. So I'm trying not to say to you, don't smoke, it's bad for you. I'm trying to say to you, you get a much better result if you don't smoke, to the extent if you cannot give up smoking, don't have the surgery. So rather than saying, oh, I'm going to counsel you if you test positive, I'd rather say to you, look, honestly, if you can't give up, then I would not have the surgery. So certainly for a body contouring, tummy tuck, breast lift, arm reduction, thigh lift, one of those, facelift. I don't do facelifts, but the same concept, closing the wound tightly. It's really bad, basically. So don't do it, particularly for 2 weeks after surgery. Curly Ellisbird. Hi, Jonathan. I sent you a message recently. I was looking for some advice, please. Well, Curly Ellis, I hope it's one of these questions I've got here. I'll read through the questions, Curly Ellis, to see if it's one of these. If it's not, then ask me directly. So what I've got is I've got Top Swing, I've done that one. Can I have breast lift and tummy tuck if I have Factor V Leiden? Why don't we offer liposuction to the abdomen alone? Is it safe to have minor surgery when on Roaccutane acne treatment? I have pain. Should I see my GP or the consultant who performed my surgery? Can we remove a cyst located on the upper lip? Do we offer warranties with our breast implants? Do we offer gastric band removal procedure? Those are the questions I've got on the agenda tonight, Curly. So if it's one of those, I will answer it. If it's not one of those, by all means, ask me or message me or something. I am sorry, it doesn't say who asked what questions, so I don't know. Although there is a column in the spreadsheet, I don't know if you're still there, Lorraine, there is a column in the spreadsheet to say who asked the question, which is not being filled in. So what can you do? You put the columns there, but that column, so I'm sorry, Curly Alice Bird, I don't know if that was you. Sorry, it was more small problem, previous surgery. I sent it via Facebook Messenger. Right, okay, well, can you kind of outline what it was? Or I don't know what happened if I log into Facebook while I'm doing this. Right, my thing is over. Facebook Messenger, right. Anyway, I'll do the other question, Curly Alice. A small problem. What we got? So here we got Facebook Messenger. How much is it to remove a cyst on the upper back? That's not you, is it? No. Okay. Okay. No problem. Anyway, I'll have a look. I'm going to do this while we're waiting. Let's not keep the viewers on tenterhooks. I've got to be honest with you, Curly Alice. I don't really understand Facebook that much. I haven't got anything from what looks like you on Facebook Messenger. So I'm assuming it's a Staiano plastic surgery page. Facebook Messenger. What we got? Messages, but not from any Sarahs. Tony, Marjorie, John, Jess, Alan, Chantel. Oh, here we go. Here's Sarah. Right. Here we go. I tummy tucked a few years ago. Every so often I suddenly turned it. Got it. I have got it here. Coffee as well, but most John said he thought this didn't. Oh no. Anyway. Every now and then I get a horrible itch feeling internal within the front central area of my abdomen below my belly button. I can relieve the itch because I can't relieve the itch because it's inside below the surface. I'm numb in that area. It's returning again and driving me mad. I had this sensation on the occasion of 2 days. Today is the third day. Previously it passes after a few days, but it drives me a little nuts throughout that time. Do you have any advice or ideas what it could be? Where to stop it happening or to relieve it? That time. So how far post-op are you? But as I'm numb, I can't. Oh God, I can't scratch it. I had a tummy tuck a few years ago. Yes, I remember. Yes, a few years ago. Well, that is. I mean, could it still be something? I guess it could still be something to do with the tummy tuck. But a few years ago, oh crikey, 2013. Wow. That's going back 9 years. Wow, blast from the past. Listen, the first thing I'll say to you, Sarah, is I hope you know this, you can always come back to clinic to see me. So if you're worried, you can always come back, we'll have a look. But in general terms, an itch is not necessarily a bad sign. An itch is usually a sign of healing. So it's usually in the early post-op period, itch is not necessarily a bad sign. It's just healing and it's totally nothing to worry about. But an itch like 9 years later, let's just see, where is it? The front central area of my abdomen, below my belly button. I mean, could it be something else? That's the only thing I'll be thinking. Could it be? Oh, helpful. Thank you. That's kind of you to say. I mean, I'm not sure whether it could still be something to do with your tummy tuck. I'll be honest with you. 9 years post-op is quite a long time. But having said that, you know, come, I'll examine you, I'll see what's what. You know, there's who knows. I will say it doesn't sound like anything worrying. So it doesn't sound like a worrying sign that I'll be thinking, oh my God, you've got to get that checked out, sort of thing. An itch, it might just, I mean, when you do a tummy tuck, the nerves are all messed about anyway. That's why you're numb. You can often be numb after a tummy tuck and get persistent numbness. So everything gets pushed and pulled about, and there's a lot of scar tissue underneath the skin. So it might just be something simple due to that. Who knows? It could be something else going on there. It's a strange one. That 9 years post-op to have an itch, I would be not worrying. I'd be thinking maybe there's something else there, rather than anything to do with the original surgery. But as I say, come and have a look. Come get on the blower, or send us a message. Oh yes, I see Amy's. Yeah, I'm back tomorrow. Yes, I'm back tomorrow. So Amy's going to ask me about that, but that seems crazy. So yeah, it does seem a bit crazy, doesn't it? 9 years after his healing. I'm not sure about that. But as I say, I wouldn't be too worried about it. But I would just say, oh, look at that. See all the comments there. I would. Oh, look, I can like the comments. I would say come and see me, and I'll have a look at it. But I wouldn't. But there's no urgency, nothing to worry about. And if you do get itches in general terms, especially when it's a bit numb, I would say to try and rub rather than scratch, because you don't want to sort of traumatize the skin and cause irritation to the skin if you scratch too much, you know, with your nails. So that can cause problems if you do have an itch. So try and rub instead of scratch, because we don't want to cause a secondary problem of the skin breaking down. Noted. Jolly good. Silvana Staiano. Lisa Collins got a question. Hi, I have a question. I have a question. Is there things you should stop doing to help during recovery or surgery, like stop smoking or drinking alcohol? Also, when would you think it's safe to drive after a breast reduction? So I would say to you, Lisa, the drinking alcohol is not a problem. Perhaps be a little bit careful in the recovery phase if you are taking painkillers like codeine, type 1s, cocodamol, coproximol, that sort of stuff. They've got to be a bit careful with alcohol. But in general terms, alcohol is not a problem. Smoking is a problem. So yes, as I say, you really need to get healed. Minimum of that 2 weeks in the post-op period, especially something like a breast reduction. It is a complete no-no in the immediate post-operative period, smoking, to the extent that I would advise you against having surgery if you cannot stop smoking. So smoking is a problem for at least 2 weeks until the wound's healed, and sometimes it takes longer than 2 weeks for the wounds to heal, particularly the T-junction. So just get those wounds healed. And I know what people say, I'm so stressed because the wounds aren't healing up properly, but you'll be a lot more stressed if you smoke, because the wounds will heal up much more slowly and cause a lot more problems. Safe to drive after a breast reduction. Sometimes you've got to check with your car insurance people. In general terms, I would say 3 weeks would be a normal kind of thing. Sometimes people are okay at 2 weeks, but it's very hard to generalize about everybody. So I'd say 3 weeks, you know, in terms of working and stuff like that, 3 weeks would be the sort of, you know, general is when people start driving again. 2 to 3 weeks, but as I say, if you need to tell work, tell them 3 weeks, and then if you're okay at 2, then you're on to a winner. So that's my advice on that one. I'm not concerned at all. I'm sure it's fine. It's just annoying. I can imagine. Thank you so much. I'll arrange to come and see you. Please do. Yes, Sarah, it'd be nice to see you. Always nice to see my patients. Mrs. G, it's a good Facebook name. Will microtape be okay to put on a hole under breast where a stitch has come out? I wouldn't, Mrs. G. No, I wouldn't. I mean, will it be okay to put on? Well, yes, but I wouldn't, because it will kind of seal it up. And if a stitch has just come out, and this does sometimes happen with well, I'm assuming it's a breast reduction or breast lift or something. Sometimes you get problems with stitches sort of popping out, and it can leave a little open wound. You kind of want to leave that open, I would say, Mrs. G. And if you do want to put a dressing on it, then fine, you can get certain dressings that might be required. But usually it's just a little hole And I would say fresh air on that one personally. I wouldn't say micropore tape, because if there is any ooze or anything like that, the micropore tape will sort of keep it there. So if there is a wet thing, you can put some gauze on. The gauze can sometimes stick, so you might put a bit of Gelanet or some paraffin gauze between the gauze and the skin to stop it from sticking, or nothing. If it's not oozing much, then nothing. And the often, if it's just not a wound problem but rather a sort of hole problem, it's more something to protect your clothes, protect your bra, rather than anything to sort of heal the wound. It's not, you don't need a dressing to heal the wound, because the wound's just usually a little hole. But I wouldn't particularly put micropore tape on, because it'll get sort of manky underneath the tape. So wouldn't be my first port of call on that one. But having said that, I think it'll probably heal up fine whatever you do. So I don't think it'd be a disaster if you put micropore tape on it, but wouldn't be my first one. Thank you for asking, Lisa. A bit late joining? No. But hi, Elaine. No, you're not late at all. I think we've only just started, it feels. Where we got to? We got to this one. Can I have a breast lift and a tummy tuck if I have Factor V Leiden? Well, when people have other problems like this, I would always seek help from the specialist treating you. So whether this is a hematologist, presumably for the Factor V Leiden, and I have treated people with Factor V Leiden, so it's fine. It's not a disaster having Factor V Leiden, but Factor V Leiden is a clotting disorder, by the way. So I'm sure it'd be fine. The only question in my mind whether we would be able to do them both, the breast lift and the tummy tuck, in one go. So because that will increase your risks. So it might be that we'd have to split them. But I would be guided by the hematologist on this to say, you know, are the risks greater by doing a longer operation rather than doing a smaller, you know, two smaller ones. You know, they might say, well, two smaller ones is just the same, or maybe even worse, in which case fine, assuming you want it done in one go. But I would suspect it would potentially be safer to do it in two goes. But if you do want it in one go, a breast lift and a tummy tuck is a very reasonable combination of surgeries to do, and surgically speaking would be absolutely fine. And I would be guided by the hematologist. And I in the past, I've done breast reconstructions on people who've got Factor V Leiden with big ops, basically, you know, 8-10 hour operations. So it's certainly possible, but it's just a question of, you know, minimizing the risks. And so whether that would be my only question, whether it would be safe to do them both together or we'd have to split them. But yeah, Factor V Leiden is okay. We can work with that. Why don't we offer liposuction to the abdomen alone? I mean, this is just me mainly. I have found that liposuction to the abdomen alone, in my hands, doesn't give great results. It's good at the hips and the flanks, the sides, but it's not good at the central abdomen. But having said that, there are a lot of people who are doing it. So it's not like it's widely, this, like I said at the beginning, everything's sort of my opinion. It's not a widely held belief. There are people who do liposuction to the abdomen, and there are people who almost make careers of it. Particularly assisted forms of liposuction like Vaser and what have you, which say they cause some degree of skin retraction, because that's my main worry in terms of the anterior abdomen. You don't get a significant amount of skin retraction, and if you don't get skin retraction, if you get a bit of hanging skin, well, then that can be a problem, and it doesn't look great. So that's why I steer clear of it. Much as I love doing liposuction, I don't love doing it if it's not going to give great results. So that is just me personally, an area that I don't tend to treat with liposuction. I would treat it with a tummy tuck, which is the best way to treat contour the abdomen. But I completely understand there's quite a large group of patients who are not candidates for tummy tucks, who just want a bit of contouring. Personally, I wouldn't do liposuction. I would put them down. I would refer them to perhaps someone who does do an assisted form of liposuction, like vaso liposuction, to perhaps talk to one of those people who are doing the liposuction, which have got some energy associated with it, or there are the non-surgical liposuction things like heat and cold and radio frequency and all sorts of things, where they just sort of you don't actually put a liposucker in, they just deliver energy to the tissues and selectively kill the fat, if you like. So they're sort of not non-surgical. I guess they wouldn't be called liposuction then, would they? They're liposculpturing. So I would refer you to one of those rather than what I do, because I do power-assisted liposuction, which means the machine goes backwards and forwards, or just simple suction-assisted liposuction, which just means that the machine just sucks. It doesn't deliver energy to the fat prior to removing it. So that's yeah. So that's just me, and again, it's a personal thing. I think there are quite a lot of plastic surgeons out there who do it. Is it safe to have minor surgery when on Roaccutane? Yeah, this is a thing, Roaccutane, isn't it? There is certainly an issue with having surgery when you're on Roaccutane, no question about it. And you need to not have certainly major surgery on Roaccutane. Minor surgery, I am not so sure. And again, I would be talking to the dermatologist or whoever prescribed the Roaccutane. And it'd be one of those situations where it would kind of depend on what the surgery was for, because in general terms, there is no question that you should avoid surgery if you're on Roaccutane. So if you can avoid surgery, so if it's something like a mole or something that's just a bit of a nuisance, but you've always disliked and things, I would say to you, look, if you're going to be off Roaccutane at some point in your life in the not too distant future, perhaps you should wait until then to have the surgery. But if it's a more pressing thing, if it's something growing or a cyst that's getting bigger or something that is a time-sensitive thing that you really did want to have it now, again, we would talk with the dermatologist about it, because it can cause problems with scarring and wound healing, having surgery while on Roaccutane. So I don't know a huge amount about it, but I do know we've had this before. And I remember when the person first answered the question, I wouldn't have thought it'd be a problem. And then when we looked into it, it was a problem. And there was, I think it was like a year or something, or 6 months or a year or something you're supposed to wait. So it's quite a big deal having surgery on Roaccutane. So not to be taken lightly. I have pain. Should I see my GP or the consultant? Following previous breast implant surgery more than 12 months ago, if nipple swelling and pain is experienced, is it better to visit the GP first or see the consultant that performed the surgery? I would say that if you have nipple swelling and pain in your breast, regardless of whether you've got implants in there, you need to seek help. Obviously, people with breast symptoms need to seek help. So you need to seek help from someone. And it doesn't really matter whether it's your GP or your consultant who performed your surgery. If you are my patient, what I sometimes find is that the GP sometimes thinks, could it be the implant? Oh, I'm not sure. You better see your surgeon, things. So I would always say to you, if you are my patient, I would be very happy to see you if you have a lump or some kind of symptom in your breast, because then I can say, oh, look, yeah, I think that lump is your implant, or, I think you need to get that checked out. And then I can write to your GP and I can say, look, I don't think it's the implant. I think there is a lump in the breast tissue, or a swelling, swelling or pain or whatever. And I don't think it's associated with the implant. So then you've got that sort of out of the way. So my patients, I would say, come and see me, because then you can get the implant thing out of the way. Because when you have an implant in there, there's always that thing, is it related to the implant? But if it's difficult to see your consultant, or if there's going to be a delay or what have you, then you do need to see someone. And I think it wouldn't be unreasonable to see a GP, but I think it's perhaps a little bit nicer if you have seen your consultant who have said it's not related to your implant, there is a breast issue there, and so that needs to be checked out. And what we'll often do is we'll write to your GP and say, look, I've seen this patient, and the implant seems absolutely fine, but they've got a bit of swelling or a problem, pain around the nipple or whatever. So I wonder whether you would mind seeing them for an opinion on that. So yeah, so if you can, I think seeing the consultant would be nice to get that out of the way. But if there's going to be a delay or whatever, then I think you could see a GP, but I suspect your GP would prefer it if you saw your consultant first. Can we remove a cyst located on the upper lip? I don't know if you noticed, but it's gone black, the writing on here. I actually preferred it when it was white. I don't know if I can change that, but anyway, can we remove a cyst located on the upper lip? Absolutely, yes, we can. Absolutely no problem at all. I don't even know why that's a question. Can we remove? I mean, I've always said we can pretty much remove a cyst anywhere. Look, I can change this. I can change that. We can remove a cyst pretty much anywhere. There are a couple of areas that oh God, find your love here. Oh God, what's happened? Is this something I've done? I do like comments on YouTube, but I'm not sure about those ones. But there you go. Let's stop. I was just trying to change the text color. Yeah, text color. Oh, what's happened there? Okay. Okay. So anyway, I'll stop that. Yeah, we can remove a cyst anywhere. So on the upper lip. I mean, the problem with the lip is what's called the vermilion border, which is the border between the pink and the skin. That's the problem with the lip. You've got to be very careful that that's lined up properly. So, you know, it's not great to have a scar on your lip, to be honest with you. A lot of people, when they have things, especially if it's crossing the vermilion border, if the cyst is crossing the vermilion border, we've got to be a bit careful with how we remove it. Now, if we're not going to remove any skin, you could perhaps put a little scar in line with the vermilion in that sort of way, which would give a nice scar, and especially scars on the red of the lip heal beautifully because scars are usually a bit red to start with. And so if they're red on the red of the lip, it's fine. But when it crosses onto the white of the lip, it can be an issue. So as I say, if you're not removing skin, you can put it in a line like that. If you are removing skin, we tend to put it like that, which is in the sort of perpendicular direction, because what you don't want to do is remove skin and then pull that vermilion up, because that can look bad. So if you're taking a mole off or something like that, then you've got to be a bit careful around the vermilion, because you don't want to you don't want the way the vermilion lies to be interrupted, because the eye can be really drawn to that. So that is a bit different, but a mole is different to a cyst, because a mole is a skin lesion. So a mole involves removing skin, whereas a cyst is a subcutaneous lesion. It's underneath the skin, so you often don't need to take any skin out. Sometimes there's a little punctum, a little hole associated with the cyst in the skin, and so you have to take a tiny little ellipse where that punctum is, but you don't have to take a huge amount of skin out. So that is better. But for sure, we can take a cyst out of the upper lip. We tend not to do them intraorally. Having said we can take them out anywhere inside your mouth. We tend to leave that to the max fax surgeons. I guess we could, but a mucus cyst and things like that, we would tend to leave that to the max fax people. Susie's in the house. Good to see you, Susie. I'm hoping you are well too. Nice to see you here. Do we offer warranties with our breast implants? Well, the breast implants themselves, so it's a bit of a confusing area, this, because the breast implants themselves have warranties. All the breast implants will have different warranties. It's a bit of a minefield, and that's one of the reasons you'll find a lot of surgeons will just stick with one make, because it can be difficult to know what's what with all the different makes. So most implants these days have got I think, have got lifetime warranties. Most of them have got lifetime warranties. The warranty usually covers the implant for rupture, and you often have to, if you do have a rupture at any point in the life of the implant, you can remove the implant, and then you have to send the implant back to the company, and they have to analyze it to confirm that it has been ruptured by wear and tear or whatever, rather than being ruptured from the surgeon, causing trauma when they put the implant in. So, but they're pretty much all of them are covered for rupture. Now, the warranties differ in that a lot of them will give you money towards the surgery, but the time frame varies. So, for instance, some of them will give you like, I think Mentor. Don't quote me on any of this, but generally speaking, I think Mentor will give you $1,000 or £700. I might be wrong with all these numbers. A sum of money towards the cost of the surgery if it's within 10 years. And then you've got Polytech. I use a lot of Polytech. Polytech have got a 2-year thing where they'll give you £1,500 per implant if you get a problem within 2 years. So so some of them will give money that will go towards hospital costs. So the warranty of the implant just means they'll give you a fresh implant. They're not going to cover the hospital costs, but some of them will give you some money towards hospital costs. As I say, Polytech's like £1,500 per implant if there's a problem in the first 2 years. Mentor, I think it's £700, I think, if it's for the first 10 years. And I think Mentor cover rupture or capsular contracture. I think the Polytech one in the first 2 years covers quite a lot. So covers problems with the implants, malposition, seroma, quite a lot of issues that could occur with the implant. So I quite like the Polytech one, I've got to be honest. I think it's quite a good warranty, sort of extends things for the first 2 years, which is quite nice. And the hospitals will usually cover you for 6 months, is usual, for problems. So that when I say that I mean cover you for all of the costs if there's a problem, if the implants aren't sitting right, or if they're too high or too low or too wide or something like that, then you won't have to pay if there's a problem with the first 6 months, or as I say, 2 years with Polytech. But the so the implant warranties are there. So then you've got to look at what the clinics do. So we don't charge for follow-up appointments. So if you have a problem 5 or 10 years or 15 years down the line, then you're welcome to come and come to the clinic and see us. But if you need surgery, you will have to pay. As I say, if it falls within the warranty of the implant and you want the same implant, you might get an implant paid for, but you will have to pay for surgery, which is quite a lot of money. Let's be honest with ourselves. Saying they'll give you a free implant is like nice, but the surgery is quite expensive often when you have to have implants changed, and the cost of the implant is only one aspect of it. Do we offer gastric band removal procedure? No, we don't put in gastric bands and we don't remove gastric bands. So gastric band is what's called bariatric surgery, which is weight loss surgery, and that will be done by a general surgeon who will specialize in bariatric surgery. So general surgeons have a specialty with regards to the inside the abdomen, in the stomach and what have you. So that's their sort of field of expertise in the bowels. And so they would be the people who would do gastric bands, putting them in, taking them out, bypass procedures, sleeves, all these sorts of things will be done by a general surgeon who is used to operating inside the abdomen. So plastic surgeons don't do weight loss operations. Bariatric surgeons do, which are general surgery trained people who then go on and specialize in bariatric surgery. So bariatric surgery is a subspecialty of general surgery. We would then treat the cosmetic consequences of the weight loss as plastic surgeons. So, tummy tucks, breast lifts, and what have you. So we would treat people once they've had their bariatric surgery, but we don't get involved in the gastric bands and what have you. Well, it's nice to be back. I'm not well, I suppose I am officially back. I just didn't have anything on today. Well, I had a call this morning, but not much. but I am back in clinic tomorrow. So, oh, hold on a minute. Sarah's in. What you got, Sarah? I had a breast augmentation mammoplasty. I've had some stitches come out and left tiny holes on the scar line. Will micro tape be okay to use? Who asked that? Look, Mrs. G asked that earlier. Will micro tape on YouTube? But I don't suggest you go to YouTube because there's some dodgy comments on YouTube, which I'll have to go back and see if I can remove. Yes. Oh, maybe Sarah Gordon is Mrs. G. Oh, Mrs. G, Sarah Gordon. Did you ask that question? Anyway, yeah, I would say no. I wouldn't. I would say you can use it if you want, Sarah, but I wouldn't recommend. I wouldn't be using micropore, I don't think, on the tiny holes. I would leave them open to the air. If there's stuff coming out, then you might need some gauze or something that you can just regularly change, because the micropore will be like a greenhouse. It'll stop the stuff sort of coming out. So if there's a little hole, I wouldn't put micropore on it. As I said before, I don't think it matters what you do. So I think you can put micropore on it. I don't think it'll matter, but because these things usually heal up fine whatever you do. But if it is a little bit oozy and a bit, you don't want it getting like a stewing in the ooze, if you like. So I would just let it come out and just put some gauze or something to catch the ooze personally. Does previously having radiotherapy affect the implants? Yes, it does, Tony. It's better to do it that way rather than radiotherapying the implants. But if you've previously had radiotherapy, well, presumably to the area, so we're presuming you mean to the breast area, then that will cause scarring. Not necessarily scarring like you'd notice it in the skin, but scarring within the tissues, and the tissues are not as pliable and do not sort of move quite as well. Paradoxically, when people have had radiotherapy on one side and not on the other side, and you do things like implants, they actually prefer the radiotherapy side, because the radiotherapy side often sits a bit more pert and doesn't droop or sag in the same way that the non-radiotherapy side does, because the scar tissue holds it up. Now, it does feel a bit firmer and it can feel a little bit uncomfortable, and it can increase your risk of getting capsular contracture, scar tissue forming around the implant. So in general terms, it's actually not a good thing for implants. Radiotherapy is not. And as I say, it can cause asymmetries if you had radiotherapy on one side and not on the other side, and you're doing something like implants. It can cause asymmetries between the breasts because one will not move as smoothly as the other one. So yeah, short answer is yeah, it does. It does affect it, Tony. Thank you, Sarah and Tony, for asking those last minute questions. Right, I'll be back here next week, I guess. No holiday, no reason for a holiday or anything next week, I don't think. I think I will be here next week, almost certain. So if you're here too, I'll see you here, same time, same place. If not, we'll have a nice time next week. Don't know what you'll be doing, but have a nice time doing that thing. If you've got any questions, send it in, message on Facebook or Instagram or YouTube or whatever you want to message it on, or just ask me live, and I'll be very happy to answer it. Tony, thank you for asking. Good luck with whatever you're having done, and I will leave you to your evening, and I will bid you farewell and good night. So I'll start the stream.